The next paper is a comparative study between 2-stage and 3-stage laparoscopic assisted anorectoplasty for high anorectal malformation, presented by Xu Li from Tongji Medical College.
First, thank you for staying. Otherwise, you're going to be regret after you cannot listen to this presentation. It's going to be interesting. Today, I am Dr. Yang Li from Wuhan, China. Today, I'm going to share research about the comparative results between 2-stage and 3-stage laparoscopic assisted laparostomy for high arm. What does the procedure look like? This is a photo from a poetry album. The girl was walking on the rope over the sea with the rolling waves, and she also has to be careful of the rain. This is exactly what's the case we met in this procedure because we have two anastomosis. One is in the closure of the stomy and the other is in the alloy ring. In this study, we have the 2-stage procedure refers to the colostomy firstly and subsequent stomach and subsequent anorectoplasty. The purpose of this study was to compare the outcomes between the 2-stage and 3-stage LAP for children with high arm. We compared two groups. The first one has 20 cases, which was done by the 2-stage lab, and 39 cases, which was done by the laparoscopic 3-stage procedure. And this is a retrospective data. We evaluate the ages at operation, operative time, post-operative hospital stays, and total hospitalization cost and complications. Functional outcomes was also assessed in our research. The mean follow-up time was about 35 months, and usually 1 month after this stoma, we do the anastomosis in this 3-stage group. The overall operative time for the 2-stage and 3-stage, there's no difference. But there were significant differences between the post-operative hospital stays. Of course, because one is 2-stage and the other is 3-stage. And the total hospitalization cost was significantly lower in the 2-stage group, which is very beneficial in this developing countries. And fortunately, the morbidity rate of the wound infection and the recurrent fasciculars, as well as the rectal prolapse, was similar in these two groups. One more thing, there's no significant differences in these two groups regarding to this functional assessment. We published our data, part of the data in the paper in GPS recently. In this paper, we do the colostomy through the umbilicus, which will facilitate the subsequent laparoscopic procedure. So this is a picture after 2 weeks, the cosmetic results of this procedure. And this is how it looks like 3 months later. And compared to this different, we can say there's the pointers out. In the third picture, there's a scar at the left upper quadrant of the abdomen, and we can see a very slightly scar on the right side of the umbilicus. So we concluded that compared to the 3-stage lab, 2-stage lab is a feasible and economic procedure. The early functional outcomes were equivalent. And we have nothing to disclose. And I'm open for questions. Thank you.
Any comment or question? Thank you very much. Very nice presentation. So the next step, you need to compare the two stages to single stage that was presented yesterday by Professor Lonely.
Yeah.
Thank you.
Thank you.